Welcome to a special episode of Beyond the Roundup. On today's show, we're going to be talking about the Danish Health Authority, which is set to cease all COVID-19 vaccinations by May 15th, at least for the time being. We're going to discuss what is happening in Denmark. And so, from Trial Site News, I am Adrian, and our episode is starting right now. So, the Danish Health Authority recently announced it would temporarily stop all COVID-19 vaccination efforts by mid-May. The Scandinavian country became the first country to cease all pandemic restrictions by February 1st of 2022, as it notified its population that COVID-19 was no longer a critical threat. The reasoning for this move was that with a highly vaccinated population, recognition of robust natural immunity for those already infected, waning infections, and stabilized rate of hospitalizations, the Danish Health Authority felt the time was right to make the move to essentially transition their nation to the endemic stage of COVID-19, as they are signaling the stance that they view the virus as essentially under control. The Danish Health Authority posted on the matter saying that there is no further plans of extensions to the COVID-19 vaccination program. Due to the high level of immunity in the population, the current third wave of COVID-19 is flattening. The high vaccine coverage in Denmark means that we can handle the high incidence of infection without severe illness. This is especially due to many given booster doses. Therefore, the Danish Health Authority has assessed that a third dose to people under the age of 18 and a fourth dose for further groups will not be offered for the time being. The Danish Health Authority is also considering to phase out the COVID-19 vaccination program later in the spring. And although we still see a very high daily infection rate of COVID-19, there are now signs that the epidemic has reached its peak. One of the main reasons for this is a high expected immunity in the Danish population due to a high vaccine coverage against COVID-19 in Denmark, and the fact that many Danes have been infected with COVID-19 within the last month following the onset of the Omicron variant. Furthermore, we know from experience that as we head into the spring, the infection rate will fall with a change of seasons. And the post went on to say that the Danish Health Authority plans to phase out the vaccination program against COVID-19 due to the high level of immunity in the population and signs showing that the curve for the third wave is flattening, combined with the knowledge of infection rates normally declining with the seasons changing. It should be noted, however, that public health officials stand ready to reactivate the vaccine program after the summer, as Scandinavia enters its chilly fall and dreary and cold winter season. But what about the booster doses? The Danish health authorities appear to want to avoid administering a fourth COVID-19 dose if at all possible. This also happens to be similar to Dr. Anthony Fauci's stance on the matter when he recently shared his thoughts about the pandemic having transitioned to the endemic stage, although it should also be noted that he has gone back and forth many times on his stances on COVID-19 policies, sometimes within hours of each other. In any case, the Danish Health Authority has reassessed all further vaccination efforts, which does include a fourth dose for high-risk cohorts, such as nursing homes. They declared that the previous assessment by the Danish Health Authority showed that elders living in nursing homes and people over the age of 85 are well protected after a third dose of vaccination. They said that following a further review of the evidence, the Danish Health Authority has assessed that a fourth dose is currently not necessary for the oldest citizens. Meanwhile, the nation's chief physician and director of the Department of Preparedness and Infectious Diseases, Danish Health Authority, went on the record saying that the high level of societal contagion has caused more infection at nursing homes and in the oldest age groups. Fortunately, at the same time, we have seen that only a few in these groups have experienced severe illness, which means there is a continued strong protection from the third dose. And at the same time, we are also seeing a decline in the epidemic, and with the spring soon arriving, we do not see the need for people living in nursing homes and people over 85 being offered a fourth dose this season. Now, the doctor went on to say that the Danish Health Authority will, of course, follow the epidemic closely, and that they are ready to change their decision if, against expectation, a fourth wave or a worrisome variant is detected during the spring. So what about the third dose? Well, the Danish Health Authority determined that at this time, based on the confluence of factors and forces mentioned above, that there is no substantive basis for offering a third dose to people under the age of 18. The Danish agency noted that the European Medicines Agency, or the EMA, has not approved a third dose for this cohort either. So what about young children aged 5 to 11? Well, the Danish Health Authority did advocate vaccination of children aged 5 to 11. Not primarily as a means of protection for the children, but instead to stop community transmission. Interestingly, this was during the Delta variant when durability challenges were first identified, meaning that breakthrough infections were already occurring with the vaccines, and thus community transmission was a reality even after one became fully vaccinated. However, the effect of the strategy has been less than they expected, especially with the Omicron variant. And so the chief physician went on the record saying that, "We extended the vaccination program to also include 5 to 11-year-olds in November, and I am satisfied with a coverage of about half the population. The effect of it is less than we had anticipated because we faced a different variant underway, but our new assessment shows that despite everything, by including the 5 to 11-year-olds in the vaccination program, we have increased the immunity in the population against Omicron by approximately 2% at an important time of the epidemic." Even though children typically are not faced with severe illness due to COVID-19, and that the protection of the children was not the primary reason for extending the vaccination program to this age group, we are happy to see very few vaccinated children getting the severe COVID-19 syndrome, MIS-C. Now, he went on to say that the agency understands that children rarely get seriously ill from COVID-19. But from time to time, MIS-C is a risk. Thus, the agency will continue recommending COVID-19 vaccination for children during the winter months as a means to protect against MIS-C. Now, we find it unfortunate, though, that the Danish Health Authority doesn't share the underlying risk-benefit calculus used to make this determination. In any case, for those of you who are wondering where the WHO stands on all of this, well, their official stance on these sorts of things is take all COVID-19 vaccine doses recommended to you by your health authority as soon as it is your turn, including a booster dose, if recommended. And there you have it. That's the World Health Organization's stance on the matter. And of course, my friends, we'll be keeping an eye on the story as it continues to develop. And that brings our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.